go.
Have you been adjusted like that before?
I have.
Okay.
Not quite that much.
Not that much? Okay, all right. Nobody does it better. Probably haven't noticed this guy before, huh?
Oh.
Yeah.
You're way stronger in person
Oh!
than on YouTube.
Okay. Well, if I'm going too hard, please let me know, okay?
Yeah, you're good.
Okay, all right. I'm a very greedy chiropractor. All right.
I'll take it.
The elbow looked so much nicer until he. Oh my gosh.
It's easy watching other people.
Cool. Yeah.
And that's a huge difference.
Cool. Yeah.
Originally, I rotated my T3
Okay.
upper
Okay.
motorbike accident, but
How old were you when that happened?
that was 7 years ago.
Okay.
7, yeah.
So just on a regular street, just crashed, or can you go a little more over that, or just?
It was a scooter in Thailand, going down the hill. A guy was following, ended up stopping. I thought he was going through the light, and then pulled the brake and went over.
Okay, I got you. All right, and so. What did you contact when you landed from that? You think what do you think first hit your wrist down
I think
or
my shoulder.
Gotcha.
Yeah.
And is there any symptoms in your neck or shoulder right now, or how are you feeling since that happened? Just kind of resolved and.
Yeah. Most of what I would complain about is just overall tightness, stiffness.
Okay.
And then I know my neck is forward, and then my jaw gets a lot of tightness.
Okay.
And clicks.
So when you were going to a chiropractor, what was their goal? They weren't really looking at your posture. They were looking at curves. Or were they doing that or?
So the one gentleman, he was an Atlas orthogonal. So
Okay.
he was working mainly with the Atlas and then using a percussor
Okay.
to put certain things back in place.
Okay. All right. I got the idea.
But-
So chiropractic started off, I call it zoomed in.
Mhm.
And my dad's a chiropractor, and he taught me Atlas when I was a kid, and Atlas is a perfectly fine technique, but it's a very zoomed in technique when you're taking T3s rotated, so you can look at the spine. And I grew up as a kid. They had a thing called a spinal thermogram. Maybe you've seen that. You run it up and down the spine.
Oh,
It's
yeah.
a temperature. So if you're wondering, when I was a kid, I watched my dad. He'd run this probe down each side of the spine, and it's checking for temperature differences between the left and right.
Okay.
And the idea is that obviously if one side's inflamed, that needle will move to the side that's inflamed.
Okay.
Now, the difficulty is what happens if both sides are equally inflamed. The needle will move and you miss it. So there's some drawbacks to it, right? If you sprain both sides,
Mhm.
then it's only checking for differences in temperature. Now, generally, the needle will move on the areas of injury. So that's where there's something injured. T3, that's what got injured when let's say you fell, or maybe even as a compensation of when you fell. But it's very kind of zoomed in on the symptom. Does that make sense?
Mhm.
And philosophically, I have some issues in terms of if the area is injured, maybe it's injured because it's moving too much, right? It's injured because it's being sprained,
Okay.
and that's why the needle's moving, because one side of your neck is sprained. You fall on your left side, you injure the left side of your neck, and so your head tilts to the right, and now you're inflaming this because your head tilted after an injury. And it's a common thing will happen. Your body will seek what we call antalgia. So the front part of your spine has very little feeling. The back side has a lot of feeling. And so as a result, when you're young enough, that when you have a fall like that, well, Ed, I felt fine, Ed, my body just changed its position, which it's like the alignment of your tires in your car. Now your tires don't last as long, and this is what you're asking me for, preventative and maintenance. The idea is, well, let's look at you from a perspective of, are you in the right alignment for longevity, right? Is there a curve in your neck? So this is where I have to zoom out, right? Because if you're zoomed in, I can't see if there's a curve in the neck when I'm so zoomed in on the spine. You have to back up a few steps and go, okay, his neck doesn't have a curve. And so other things we know about the curves in the spine is that when you lose the neck curve, it can go into a laterality somewhere else. And so sometimes there are rotations or tilts or scoliosis can form as a result of losing what we call cervical lordosis.
Mhm.
So there's a natural curve that you develop when you're about 3 to 6 months old, and this is supposed to take you through life. You're supposed to have this curve and allows the weight to be evenly distributed, meaning that not any one area that probe would detect be overstressed if there's a curve in your spine. The same thing in your lower back. So we call this global postural analysis versus
Okay.
Atlas and orthogonal, which does a more segmental approach. The position of this vertebrae next to that vertebrae, the position of this vertebrae, they're looking segmentally. I look globally, which is, do you have a curve in your neck? Is your ear over your shoulders? Are your hips level? global postural analysis, Atlas Orthogonal and Gonstead. Those are more like those were started in like the 50s. There's a little bit. They've been around a lot longer. My dad was taught that, when he was in school, and I had as an elective. The iPhone update came out. And I call it, that we can't change posture through adjustment. That's the first fallacy that my dad. The main thing that helps with the Atlas is that the table you lay on actually changes your posture. When you're laying face down on that Atlas table, that table actually holds you in the mirror image, and that's good. They actually do the clicker while the magic is the table. My dad would say he's kind of like the secret of Atlas. Like that table is the amazing thing because it actually holds your head in the mirror image, and then you stimulate all the proprioceptors with the activator. That's what you're doing, and you're trying to reset someone's posture through your cerebellum. I know I'm applying too much information, but it does work. It's just a little bit more segmental than I like. I sort of zoom out and I want to influence the ligaments that wrap your spine, and that's what I look at a picture for. I would look at your X-rays, your MRI, and instead of looking at each segment, I'm going to look, this whole curve here is not where it should be. Let's work on getting your neck curve back. And so somebody online will go, Ed, you diagnose all these different types of problems, but you treat them the same, because I don't treat symptoms, guys. I treat posture, right? Is your spine in this alignment? You understand? Do you have a curve in your neck? Do you have a curve in your back? Or is your head forward and you've lost the curve in your neck, right? And then because we're not in the right posture, now you have pressure points, now you have pain, now you're gonna have things that are gonna cause that needle move because you're not where you're supposed to be. Your head's tilt, it's really a right neck.
Okay.
Your head's tilted left, and then you're doing this essentially. I'm
Okay.
exaggerating, but that's the
Yeah.
that's the misalignment. Chiropractic biophysics, they do them as 3 different grades. The first misalignment is a head tilt. Second is they'll call the writing reflex, your eyes are level. And then if you keep this long enough, eventually your shoulders will level, but then your head will just be translated. So we call that translation when it's been there long enough. So you actually are in what we call phase 2, which is the head tilt, and now you have the shoulder tilt, but it's really a head. We're going to find it on the right side of your neck in a second. You have an injury over here that's made your head avoid it, and then hence why it's not bothering me. Well, that's because you're in avoidance and you're young enough that you can continue avoiding it until you're 35 or 40, and then the problem can grow large enough that you no longer can avoid it, and now that's when everybody all of a sudden starts to agree with me and say, oh yeah, there was a problem over there. No, there was a problem back when he was 27 and he was in avoidance, and we should have confronted it then. We got to get that suppleness back to your middle back here, because the head's forward, head's about 1.5 to 2 inches forward. When your head goes forward, your middle back gets tight, right? So your ear, external auditory meatus, should be over the center of your shoulder from the side. And when the head goes forward, there's going to be perpetual stiffness and tension, and even rotations of T3. Do you understand? Because the head's forward.
Okay.
And so ultimately, we've got to the care has to be focused on lining up, called the EAM, center of the acromion, side of the hip, side of the knee, and the lateral malleoli. That lateral malleolus, lateral part of your ankle, that should line up with your ear hole. Do you understand?
Okay.
So if you do what we call a plumb line, if you look straight from the side, here's where your malleolus is, right down here. That should line up. That does line up with your acromion. Do you understand? So you're not angled forward so much with your chest, but your head's just forward. Even jaw pain happens because of the head being forward. So as the head goes forward, the jaw starts to go forward. That starts inflaming the TMJ. And so forward head posture and jaw pain are connected. And so you can rub the jaw and do activator on the jaw, but ultimately if we don't get the ear back and the head back, and so we'll show you some things called Denerals, which are the ways we stretch the spine. It's stretching that took this is again 1997. Chiropractors figured out that you have to stretch the spine to change its position. So adjustments, as much as I wish it were true, can't move your head back over your shoulder. I can't just the ligaments that wrap the spine have to be influenced. Bend both the knees. Yep, feet flat. Cross the arms for me. You're doing great. Take one deep breath in and help me sit up. Help sit up for me. Deep breath in. Deep breath in. Exhale. All right, deep breath in. One more. Let it go. All right, good. Stay out there. Stay and breathe. Yeah. All right. So some bones moved. I had to put a lot of pressure on them, but with your age and with your work, I'm impressed that there was any movement. Because generally when you're holding something or lifting
Right.
something, you want to lock your chest, right? So carrying something, you don't carry something like this.
Sure.
You lock your chest, right, and you carry it, right? So your job encourages chest stiffness. You're saying you're a better mover with a locked chest. It's not great for longevity. That's the problem. In order for your spine to last as long as possible, we need to encourage your middle back to be loose. And so the idea would be that you keep doing your work, you gotta get paid. But at the end of the day, we do things to keep it limber for longevity. And then hands on your belly. There we go. Look over this shoulder. Just turn your head up with that little back of your head. There, perfect. Just like that. Deep breath in for me. And then exhale, twist. Good. Other side for me. Good. I gotcha. And exhale. Exhale. Good. Face up for me. Maybe come upwards a little bit. There we go. Okay. We'll move it there. All right. Let's see. Where is this? Yeah, right. Yeah. It's right here. It's a little lower. It's not the atlas so much. It's kind of the middle neck right there. That's C4, C5 on the right.
Huh.
The atlas is not. Maybe minimally. Got a very small atlas misalignment. A little bit to the right.
You can tell that just by feeling it?
Yeah, the wings. You can feel the wings. So you can feel the. In school, when you're learning it, you feel like little. They're really long.
Oh, okay.
I mean, really long. Look at the wings of these guys, right?
Uh-huh.
I mean, they're like freaking. They're sticking out there. So that's what I'm feeling. I got my hand. I got my fin, and they should feel like a little pencil eraser underneath the skin. Is what they teach us.
Okay.
So now, if the bone is over to the side, then I won't feel one side, and I'll feel the other side
Right.
sticking out like a Frankenstein bolt. So I got your head level with your shoulders, and I'm feeling for the atlas. And I got there's your atlas, right? That little right there. That's your
Yep.
atlas right there on the right. And I got a pretty good palpation of your atlas. Now, if I tilt you, watch. If I tilt you, now it's sticking out over here.
Right.
Right. But you have to be level, and then we feel the atlas, and I have it pretty level. But now I go down to this lower vertebrae. So here's C2. This is your second cervical vertebrae. He's over to the right. And then the whole thing's blown out to the right. This is all sunken in over here. And then you got a massive blowout down. You look up, feel that giant knot here, and I got like nothing here on the left. So you're in right avoidance, but it's kind of the middle lower neck that's doing it. I would argue that this happens because this is probably stiff up here. So the upper neck is stiff, the lower neck got overstressed. Now the lower neck is tilting because the lower neck shouldn't be doing a lot of the work to begin with. And so as a result of the lower neck being overburdened, now your body's trying to, and maybe an injury or maybe even that fall, which you said was left shoulder, fell on this side.
Yeah, left.
So,
Believe so.
you jammed, maybe that tore the right side of your neck out. That makes sense. So the force went into your left shoulder. Your head would have the main force would have been the left head tilt. Do you understand? When you collide on the left side,
Right.
so you would rip the rubber bands on the right side of your neck. And so this doesn't have the power to pull this back straight because these ligaments have been torn. Could be. I don't know. It could be many things, but that's a possibility. This is definitely all pressed out here on the right side. When you fell, this upper neck should have absorbed most of the force. The lower neck shouldn't have been the one that was in the front line to begin with. So the lower neck will get happier when it sees that the areas around it start doing more work and the burden being off of it. It'll move also at the same time, but I don't want the primary amount of force, there you go, to be in the lower neck. That feel you okay?
Yeah, good.
Relax here. Chin up for me a little bit. Very nice. Okay. Have you been adjusted like that before?
I have.
Okay.
Not quite that much.
Not that much? Okay, all right. Nobody does it better. That was a test. I'll show you the left side in a second, but
Okay.
that is an injury.
So it gets pulled and forms into a knot?
Right, your body expects it to happen again. So whatever stress happened in here, part of it is the muscles are protecting it. You have guarding.
right? Your body expects you to fall off another scooter or whatever, but motorcycle, whatever. Your body expects it to happen again, and so it puts up a wall in anticipation of a future. And so for the longevity of your spine, we can't let it stay there. It has to be, the dent has to be pulled. There's a dent here kind of idea. I got your head, there you go. And then it makes your neck more prone to be comfortable with your head forward with a loss of the curve. See, this position, your neck belongs way back here,
Oh, wow.
right?
Yeah, no.
Your neck belongs here. This is where, again, your jaw would be happier.
Right.
Your head's forward. I looked at you from the side. Your head's 1.5 inches, 2 inches forward. That's your problem. Head weighs about 10 pounds, 10, 20, 40. It doubles every inch. So your muscles in your neck feel like they're holding a 40-pound head. Their spec rating was to hold a 10-pound head. So they're going to age at 4 times the rate because they're doing 4 times the work. And it's going away actually pretty good. It's nice being 27. 26 is when everything starts to harden. So you're right at the cusp of where changing the posture becomes more difficult. So
I'm going to ignore that.
What is it?
I'll ignore that.
So what I'm saying is easy to change this at your age.
Okay.
And so you can make, it's actually changed dramatically. This knot has gone in just by holding you to the right for a little bit. Yeah, it's pretty remarkable actually. It's almost getting this pretty. So the idea would then to hold that with this piece of foam called a Denerol. It would actually emulate my thumbs and hold you in this position.
Okay.
And that's how you accomplish it. 20 minutes for 20 times stretching, and we'll show you that at the end. It feels great. Wow, that's nice. Yeah, it's like, see how it's just smooth the whole way.
Yep. Yeah, that's.
I mean, it's blatantly obvious. There's no bump over here. That's what I was feeling when I had your head straight. And Ed, I feel like you rub the right side of the neck a lot longer than the left side. That's correct. I'm not going to rub the side very long. There's nothing here. My dad taught me you don't arbitrarily rub something. Right side, right there. When there's dead blood, congestion, lactic acid, inflammation trapped in these areas, combing the tissue is going to draw it out. The mark is never normal. The mark is a result of what's been encapsulated in the tissue. You understand? So my point is that as my patients progress through this type of care, no marks come out. You understand?
Okay.
It's not breaking blood vessels, because if it was just breaking blood vessels, I should be able to break them wherever I want to break them, whenever I want to break them. Does that make sense? But the mark only comes out in certain areas. And generally, it's like running a vacuum cleaner. The first pass you make, you get the most out, right? And then every subsequent pass, you get less and less dirt out of the carpet as the spine becomes cleaner. And then also you teach the patient to take their shoes off the front door, and they stop tracking in so much mud. And then the carpet stays cleaner. Does that make sense?
Right.
A lot of these areas that are tight, because of the posture, because your head's forward, these areas are really tight, right? And that tightness in the muscles restricts blood flow.
Okay.
Right? So think of the blood vessels that are trying to perfuse this tissue. The tight muscles from your work, from your posture, limit circulation, which then allows the dead blood and lactic acid to build up from that stiffness. And it'll directly correlate with where you feel symptoms. You go, Ed, there's something right there. That makes sense. I'm sure you feel there's some soreness in there. It directly correlates with what you feel. When the upper neck's not doing what it's supposed to do, your lower neck will be overstressed, and then you actually recruit your upper back to do work that this was supposed to be doing. So you'll actually torment your upper thoracic vertebrae because the upper neck is stiff, because this is tilted. And that's probably as most obvious as it'll get in my office. It has to do with the head tilt. So if everybody at home can see, because his head's tilted left, his left shoulder's elevated. Because his left shoulder's elevated, this is all expanded open. This is not its own monster. This is a result of this, is what I'm trying to say. You're saying this is a mirror, this is a reflection of this. Okay? It's not its own problem. This is a compensation of a neck misalignment, but this is a larger one. If I put a marble on your back, it's going to roll off to your right. Do you understand?
Yeah.
This is low. You'll feel it. This is low over here, and it is massively popped up right here.
Oh, wow.
Nobody said anything like this? Nobody. I mean, this is not a small one. This is eventually going to cause right sciatica. So because this is stiff,
Okay.
the right lower part of your back will be the first part that wears out. Again, you're here, and hopefully we'll never get there. And you're saying, I'm just telling you what, if you don't have a person like me or me in your life,
Ed, my right leg, you're right, Ed, you predicted the future. My right leg was starting to have sciatica, right, at 40. You understand? Because we left this here for too long. This is going to throw the work down to here because you're in left chest avoidance, you're in right lower compensatory abuse. You told me preventative. I looked at your paperwork. So I'm giving you.
Appreciate it.
My wife's always like, what do you work on? I'm like, I will address every single thing that person puts in major complaint. The fix is to mobilize and restore the alignment of your spine, specifically right here. This won't go away if we don't fix this. This will keep getting fed, kind of a domino effect, because the head is tilted. But that doesn't mean that we can't work on this. BJ Palmer would have spent his entire visit in your upper neck. I don't agree with that. I do understand what he was getting at, which is that if you don't fix the neck misalignment, that you can't ultimately fix this either. But that doesn't mean that we can't speed this process up by working on both and working on everything. There we go. Anyway.
Prevention and random facts.
Yes,
about
I know.
chiropractic.
Well, if you go in my office, I have a picture of BJ Palmer on the wall, and it's like, why does he have his photo on your wall? Because he is the reason why we're here today. If it wasn't for BJ Palmer, there wouldn't be chiropractic as we know it. His father, started it, but he was the one who basically opened up the schools and, wanted to get it into the masses and teach people how to do this and help people. There we go. Probably haven't noticed this guy before, huh?
No.
Yeah.
You're way stronger in person
Oh,
than on YouTube.
okay. Well, if I'm going too hard, please let me know, okay?
No, you're good.
Okay, all right. I'm a very greedy chiropractor. All right.
I'll take it.
That's so funny.
The elbow looked so much nicer until he. Oh my gosh!
It's easy watching other people.
This is for everybody at home going. That looks nice. I don't know. No.
That's my favorite comment of the day.
No. Well, like I said, we don't need to, I'm not here to overwhelm people, but I am here to confront. I'm here to show you this needs to be confronted.
Mhm.
It will not go away gently. It has to be grabbed and like thrown out of the bar kind of idea. All right. Take a break.
What is that?
That's my dad. That's my dad over there.
No, what you just touched.
Sorry. These are the roots of your neck. These are the roots of your neck here. I wonder if we could hear my father. That was my father. So these are the roots of your neck. These are the thoracic outlet, first ribs here. Trying to bring these ribs down. They elevate at the same time your head goes forward. So we call this coupled motion. When the head goes forward, the ribs in your upper back elevate. In order to bring the head back, these do need to go down. They both work together in concert. These have to go down, the head has to come back. Right there, yep. Okay. There we go. Okay. So you have 4 large muscles that attach in here. Your diaphragm, your trap, your lats, and quadratus lumborum. It's like a Times Square intersection. And so this area, especially when you're carrying or lifting, this area locks, right? This is where, when you're lifting, you should try to exhale,
Okay.
right? You don't want to be, the fastest way to injure yourself long term is to hold your breath while you're, lifting and hold. It's why you try to exhale when you're lifting. These are good habits to install. What exhaling does is it forces a diaphragmatic relaxation, right? You're relaxing your diaphragm when you're exhaling. So this area that's used to fortify, to stiffen your chest is also forced to be a little bit more limber when you're exhaling. The stiffer this becomes, do you see how this overstresses, right? Because this gets all jammed up here. Yeah, right there.
when you're sitting in your desk or on the airplane, we're gonna actually put something behind your back right here. Where you should take a rolled up towel or a pillow, kind of middle back.
And
This
put
is-
it lengthwise or tallwise?
Well, kind of be, I guess, not lengthwise, transverse or perpendicular to your spine,
Okay.
right in here. We're trying to prevent this from slouching out, from rounding out.
So just on the left side.
Well, both sides would be fine, but yes, I mean, if you could wedge it more on the left, that'd be better, yes. But it doesn't need to be, I'm not looking to go intense or, if you move to Sarasota for a month, then we can get intense, but for a preview, the idea would be that, yes, to move up to something more intense, but we want to first get you limber, get the spine clean. So the beginning tools that I can show you are, just starting to put some pressure here when you're sitting, when you're, like I said, airplane, or when you're at home, whenever watching TV, you don't want to be sitting just rounded out here. First way to fix a problem is to identify it. No one even identified it, so that's the problem right there. And it's like this whole section. It's like T8 through T12. You understand? The whole section here
Right.
it's not just one vertebrae. As I said, I'm zooming out. This in and of itself wouldn't be the symptomatic area, like I was saying earlier. The right lower back would be the compensatory. This would just lock. It'll be most uncomfortable when you're worked on because it's the stiffest part, but most people wouldn't notice this until it's elbowed, until it's adjusted. We don't feel the tight parts of our back, the parts that don't work. We only feel the areas that are compensating.
How long do you think it would take for that to be an issue?
For the lower back on the right, that would
Yes.
be another 10 years.
Okay.
Yeah, it would be a while. You probably have to minimum another 5 years, but probably by late 30s, this would become a problem. We could, an MRI would give some information on that, but our world really doesn't do healthcare on this. They wait till the disc gets injured and then we respond. The healthcare would be, let's not let the disc get injured to begin with. This area being stiff up here is going to start overstressing the disc on that right lower part of your back. Getting your lumbar curvature back to your spine, keeping your middle back lumbar is going to prevent all of this from even happening. This side is not nearly, just like the left side of your neck is not nearly as elevated as the right. I mean, there's some, but it's not nearly as big. One side's getting an F, the other side's getting like a C+. You understand? C+ is pretty good at. Okay, well, whatever, but it's not an A, but it's not an F. It's a pass rating. I give the right a pass rating here. I try to help people understand. I mean, I had a chiropractor as a father. Like, I was worked on all the time, and my dad had that spinal thermogram. As a kid, I used to watch hundreds of people getting that done.
Yeah. That's all my shoulder right there?
Yes, sir. Yeah, subscapularis and ribs in here, rhomboids. So very quickly, you can see it right there. That's where the epicenter is. Like I can comb everywhere, and not nearly certain areas to come out with a darker mark. Where internally there's blockages. I'm almost going to draw an outline of it. You do a shoulder workout every day, and I feel it all here. Jeez. I got you. Oh, I didn't know that was over there, Ed. I know.
What is that?
This is your rotator cuff.
Okay.
This is what your moneymaker, I imagine. This is what allows you to work so hard. But there's a lot of tension in here. I was feeling. So I wanted to shine a spotlight on it for a minute.
Yeah, never felt that.
Yeah, you gotta clean this out. Your lats a little bit too, but mainly rotator cuff and lats.
Did not know all that was supposed to move.
Yeah, I just this is ancillary buildup that your job has created. This is not. I don't particularly think this needs to be worked on all the time, but I'm just since I feel it, I'm going to clean it up anyway. Getting your posture fix is primary, but
Right.
that doesn't mean we can't help to clean up some of the other messes in here. But being a mover, my gosh, your chest just needs as much
Oh yeah.
limbering as possible. Like I said earlier, because your work encourages heavily stiffening this area, and so as much as you can get, you're going to get some benefit. I mean, of course, just the deeper that you can get, the better, and the more that you can handle, the better in terms of the depth. All of this should be easy. There is no normal soreness. There is no normal pain. You know, when I rub your back, it's not like, oh yeah, that's just the normal part that hurts. Like, no, sorry. You should feel pressure, and that's it.
Yeah, I didn't know all this hurt.
Right. I know. All right. We gotta work through. Right there. Yeah, if I didn't know better, that shoulder hit, you're saying you hit this whole section, you understand?
Yeah.
Got collided with, your chest leaned to the left, sorry, to the right, and then your head tilted left. That would be my opinion of that whole, that accident. And then you healed crooked. And then because you healed crooked in avoidance, there was no pain.
Right.
Until such point in the future where now the alignment causes a compensatory pain from the frame not being on straight. But this all got to me, like I said, you got hit and then you tilt to the right. I know this is what hit. Does that make sense? But this, they both took it. There's way more here on your left. I mean, that's a significant amount of injury, congestion. Your body expected you to fall again. You understand? When you fell, as a result of it, your body's like, "Oh, is this the new normal? You gonna do this again?"
Right.
And so it put up walls and and tightness in anticipation of it happening again. And even though you're like, no, body, I'm not going to do that again. Your body doesn't believe you.
Yeah, no.
It's like, I don't trust him.
That was the last time I rode a two
Right. No. But yeah, right there. I mean, I can't make a mark here if I wanted to. Like, it's just here. Like, I'm combing everywhere. That's what's so cool about this tool. I can comb everywhere, but like no mark here. But there's a huge mark right here. So it happens because that's what was damaged, and then the body tightens it up, it hardens the tissue, blocks the circulation. The more forward your shoulder goes, the easier it is to injure your rotator cuff. So at the end of our visit, when we're stretching, I'm going to show you some things to actually draw your shoulder back, making it harder for you to injure your rotator cuff. So the more, you see how the more forward your shoulder goes, all these muscles are held taut like ropes? So think of a cable or a rope that's held tight or taut. It's easy to cut it, right? But if the rope is held loose, it's harder to cut the rope. You understand?
Okay.
So the tendons and cables back here are held tight when your shoulders round forward, which again, your work requires, making it so at some future date, you tear your rotator cuff. You understand? These are common injuries that happen to the shoulder because of alignment. You were set up for it. Nobody wanted to try to teach you how to get your shoulder back to make it harder to injure your rotator cuff. And again, he put prevention on his chief complaint. So I'm going to give you all the preventative. Today's visit's about how do I not let anything happen to me? Well, let's get your shoulder in the right alignment. Let's get your back in the right alignment. And then, not to say you're immune. I didn't say. I said it harder. You understand? It's going to be harder for you to get injured. More stress, more severity to reach that point. But yeah, anybody can fall off something. Anybody can get injured. But let's try to get it on the path of highest longevity. So the more inflammation that's on the back part of the shoulder also, it's going to make your shoulder desire to go forward, right? So that makes sense. The more bruised this is, the more your body antalgically wants to rotate your shoulder forward to get away from it. And a mark's coming out. The mark's like the cheating way to know when there's an injury inside, because it only happens where there's something that's been internally damaged. And this is where the collision is also. So, and that, you already told me I fell on my left shoulder, so I expect to find some induration in here. There's someone out there that sounds like me. Who could it be? Maybe Dr. Bell. My poor patients that are in my normal practice are always like, "What, did you clone yourself?" There's like two of the same voice in this office.
I think you sound different.
Okay, thank you.
Oh, no kidding.
Right, it's that left. That's
Yeah.
something happened over here. But that's there's one there, and then on the back side, yeah, right there.
Oh,
So
wow.
you can see there's some over here, but right there.
Yeah.
That's where that epicenter is. I mean, T3, I don't know whatever. That's a result of the other guys, in my opinion. All these other tilts and shifts are now, making that guy move. But I got you. Ooh, yes. Dr. Ed, you're amazing. That's okay. Good, I got you. Okay. That left side. It will auto level as we stretch. Do you see how when we're going to be on our stretching in a second, you're going to feel crooked on it, but it's not that you're crooked on it, it's because your back's not level.
Right.
So you're going to feel like you're not on it straight when you are on it straight, but because your back isn't level, you're going to feel lopsided. And then as you progress through it,
Right.
you won't feel lopsided. And then, yay! But I'm just giving you a preview where we're heading in a second. You're going to feel like, Ed, I feel like it's pushing more on my left side of my back. Correct. This side is more like this is even pressure, but the left side is so much more elevated that it'll feel like there's more pressure on the left. Yeah, having a chiropractor as a father and analyzing postures since I was a teenager. That's all I. My dad and I would be out at the mall just looking at people's posture. I mean. my hand. At church, everywhere. People always like, stop, don't look at my posture. I'm like, I'm not looking at it. Can't turn it off. Nice.
That's crazy. Yeah, I've never been able to do that.
Yeah. Oh, no, yeah, cool, yeah.
I mean, that's a huge difference. Cool.
Yeah, these were all stuck. You gotta get, and then the idea now is to actually hold you here.
Right, right.
And then the next time you go, and then you go, and then you,
Yeah,
I know, it's very nice. You don't have a rod in your back. I don't have a rod in my back.
Yeah.
The potential shouldn't be any different. You have the same vertebrae, the same vertebrae in your back that I do. It's the fact that if you don't use it, you lose it, and you're a lot stronger than I am. I'm sure holding an object for all day, I'm gonna fatigue out and you're more powerful. So with power comes to stiffness. You have to tighten your back to be powerful. So there's a balance of that I'm trying to teach. We need flexibility for longevity, you need power for your job. One second, keep your head straight. Okay, now tilt right for me, tilt right. Okay, so all right. Sometimes you don't get them. Tilt to the right for me a little bit, tilt right. Okay. Okay. Go ahead and tilt to the left for me. There we go, a little bit. Go ahead and tilt to the left. Okay. Do everything. Good. Hand on the hip for me. Go. Press back with your elbow into my elbow. I think it moved. Perfect. Good. Good. No, don't ever like this. Always just straight pull. If you ever have to release, just straight traction. You're not gonna hurt anything. Just tractioning, opening the joint, getting blood flow in here. There we go. Good. No restrictions. I'm feeling for there's 2 rows of 4 bones, and so I'm looking to make sure all the bones are moving in here. Sometimes you'll have injuries. I'll go to bend the wrist, and it's like I hit a wall. I don't on your wrist. That's what I'm feeling for. What do you feel? I'm feeling for suppleness inside the wrist. Same thing, elbow, I'm looking. There we go, a little bit there. And put this on your hand. And press back. There we go, yep, good. All right, come on over here. I'm gonna show you this. This device is designed to be rigid, and your neck is designed to bend around it. Lift that for me. Lay your head back. There we go. And then what you'll do is you'll take your hand, place it on your forehead flat, and then you press. That makes sense? So you gotta get your head to sink in. And then because that right side of your neck is a little bit more popped out, you can do a little bit of right rotation also.
Okay.
So to get a little bit more pressure on that right side. That makes sense? These are powerful devices in changing your posture. The goal is 20 minutes. 20 minutes is not a made-up number that I thought sounded cool. 20 minutes is a real number for stretching the ligaments that wrap the spine. They fatigue, or what we call ligamentous creep. At about 20 minutes, they actually start to lengthen, and that's where posture change starts to happen. So the goal is to hang out here 20 minutes, put a TV show on, lay on the floor, and it's just really about trying to let your body sink into the floor, letting your neck relax, letting the tension in your jaw, face, everything, all that's happening because your head's forward. You are ready to use the roller. Go ahead and sit up for me. Lay back for me. I got you. Okay, good. Lay back. There we go. Head back for me. There we go. You're going to want some books behind your head. Bend the knees for me. What the books do is they prevent you from bending too much in your neck. So your lower back and lower neck relative to your middle back and upper neck are very loose. So if I bend you back, the loose parts of your spine are going to want to bend the most. And that scares me because I don't want to injure the ones that are already moving too much. So to prevent that, we use some books behind your head to make it bend just where it's pressing on your back, not in an area that we don't want to bend.
Okay.
As your middle back starts to bend more, we can take these out. Eventually, these don't need to be here at all. The goal is time. Time is more important than depth. First, get to 20 minutes, then we can start reducing the depth. If you're not worked on at a deep level, that's why I have an office. Otherwise, I would just self-stretching, because you can't take a layperson and put them on this. They have to be beat up. All that inflammation in your back has to be cleaned out.
Yeah.
And then pretty quickly, like just if you were here in Sarasota, by visit 5, 6, 7, all that bruising would stop happening. You understand? I wouldn't be able to make a mark on your back anymore. And also, you'd be another 2 inches deeper on this, because all that fluid and inflammation would dissipate, and your range of motion would increase even farther, then further negating your need for that anymore. And we give you a longer leash.